Awesome. Thank you so much. So now that we've talked a little bit about consent, let's talk about STIs. So a question for all of you out there, is it true or false that in order for an STI to transmit from one person to another, some kind of penetration needs to occur or fluid needs to be passed? So take a second, think on it, true or false? It's actually false. So STIs can be transmitted by a variety of different types of things, including any type of sexual contact. So what exactly is sexual contact? How do we define sexual contact? And yeah, what exactly is it? So we basically just want to first validate everyone's versions of sex and sexual contact. Like the way that you define sex may be different than another person, and that's perfectly okay. It could be hand to genitals, mouth to genitals, genitals to genitals, so many different combinations, and you can see here on the slide just some of the many possibilities. The one important thing, though, to remember is that all sexual contact comes with risks. So we need to be able to know what those risks are so you can have a safer experience. So that's basically what we're going to be talking about after this is a little bit more about how you can have a safer experience during sex or any type of sexual contact, no matter how you define it, and no matter what you're doing.
All right, so as Hannah mentioned, we're going to be talking about the different behaviors that sex can have and the different types of sex that there are, and then the risks that there are in those types of sex and how to make them safer. And one risk that everyone faces is individual discomfort or exploration. And this can be so many different things from an individual basis and an individual encounter. So each experience you have is going to be different with each individual or individuals. And some discomfort you feel in some situations, you might not feel in others, or vice versa. And there's just so many different experiences we have and explorations that there are. So just know that there are different types of discomfort and explorations that you're going to experience, and just how to, kind of go through those emotions and those thought processes, as well as not just the physical things that you're doing. Okay, so first off, we're going to talk about solo sex and what that kind of means in quarantine times. So health officials ask you to please masturbate because of the coronavirus, especially for LGBTQ plus individuals. I know Grindr is a big hookup app that a lot of people can use for gay individuals and things like that, which is great outside of quarantine times. But during these times, we really kind of want to mitigate and reduce those risks. So we're really trying to just use other kinds of sexual activities, such as solo sex. So what is solo sex? That can be masturbation, masturbation with pornography, or just watching pornography. And what are the risks? So with solo sex, very low risks for STIs, but there are more risks for bacterial growth or infections, especially if you're using unclean sex toys. So if you're not properly cleaning those, that is a risk that you can get. But otherwise, pregnancy risks, there aren't any, and STI risks are really, really reduced. So there are some ways to make it safer. So if you are using these sex toys during masturbation, like I said, make sure they are cleaned properly. So some sex toys will have instructions on how to clean it. There are general guidelines that you can Google, like how many parts bleach to how many parts water, or you could just get certain cleaning materials online. And then one thing to keep in mind for certain sex toys like jelly toys, you can't properly clean those because they're so porous. It's hard to get a good clean with them. So it'd be recommended that you use a condom or something to protect them so they don't get those infections and bacteria in them. So another type of masturbation that we want to talk about that really reduces risk is mutual masturbation, which is a very, very valid way to have pleasurable sexual encounters, especially with your partner or partners. So mutual masturbation is essentially when you're in the same room as your partner and you're both it entails touching yourself in a pleasurable way while your partner is also touching themselves in a pleasurable way. And this could be a very very varied. You could have very steamy hot talk while you guys are doing this. You can fantasize in your head while you're discussing that as well. Specifically during quarantine, a great resource that you can use is FaceTime with your partner or partners while you're doing mutual masturbation. If you'd like, I know a lot of people have been using Snapchat as well, or even Skype. So virtual sex is extremely valid and very important when we're going through these really tough times to make sure we are still having that healthy sexual encounters and we're getting those pleasurable experiences that we want. But, like we said, mitigating those risks of corona at this time. So yeah, I would definitely recommend masturbation or mutual masturbation with your partners if you are a little bit sexually frustrated. Okay, so continuing on sex toys, those risks are a lot lower for STIs, unless you are using it with a partner, but even then, it is a lot lower of a risk, but there is bacterial growth, so make sure you're properly cleaning them. And to make it safer, lube is a great resource to use. We'll be talking about lube a little bit later, but for most sex toys, lube is a great resource to use to make them safer and more pleasurable. And then, as I mentioned previously, condoms, especially for those more porous sex toys. And just to reiterate, proper cleaning, and it depends on what kind of toy you have and what the material is. And then we did have a question submitted by someone. So what are some common sex toys used for solo sex versus with sex partners? So I'm going to let Hannah and Brianna chime in on this as well. But for solo sex toys, it depends on your preference, honestly. But a lot of people, the most common one is like a vibrator or dildo for like personal or solo sex just with yourself. But with partners as well, you can use them. They're great resources. So what are some other ones you guys think?
I think you named the most common ones that I would say. There's also like cock rings a lot of people can use, especially during sex with a partner.
Butt plugs as well.
Butt plugs, yeah.
I think that's about it. But yeah, there's a whole bunch of different types of sex toys up there. That's a fleshlight that a lot of men use for masturbation. So I don't know. It depends on your preference, but those are probably some of the most common ones.
Okay, so now we're going to be talking about sex with hands, which can really just be anything that you're doing in a sexual way that involves your hands. So this could be fingering someone, rubbing someone down, penetrating them, really just anything that involves your hands. And so theoretically, there is a chance of transmitting STIs, especially because sexual fluids would be involved. So if you're putting your hands up by your face or down by your genitals after fingering someone, there is a chance for transmitting STIs. And so a big way to make it safer is, again, being informed, knowing someone's status of if they have an STI, their STI history, keeping your nails trimmed because that can lead to scratches down on the genitals, which has a more direct route for STIs to be transmitted, using gloves, which we'll talk about later, and then also just using lube to prevent any micro tears.
Awesome. Okay, so what is oral sex? Oral sex can be on a vulva, anus, or penis, and it's using your mouth on those things. During oral sex, there is a risk of STIs. All STIs can be contracted through oral sex, and so that's why it's so important to know your partner's status and your own status, to use things like dental dams or flavored condoms. Yeah.
Then penis to anus intercourse. So that is sex with a penis and an anus, obviously. So it may involve penetration, it may not. There could be some foreplay or some teasing going on with that as well. But what are the risks of that? There are risks of STIs, obviously. And then another risk that not everyone may experience or know is hemorrhoids. Everyone can get hemorrhoids, but especially for gay men, it's a little bit heightened if you're partaking in penis to anus sex. And then how to make it safer, status knowledge, Obviously, using condoms and lube, and then PrEP and PEP is also a great tool that we're going to be talking about as well.
And then vulva-vulva intercourse. So sometimes that's referred to as scissoring or tribbing. It's when one vulva is pressed up against another. There are also risks of STIs in this situation because you would be having skin-to-skin contact as well as possible transmission of fluids. Same sort of ideas to make it safer, know each other's status, use dental dams or plastic wrap. You can even rub your vulvas with clothes on, or lube. Also, lube is great.
And then we have penis to vulva intercourse. This is the one we typically hear about, but we're going to put a queer spin on it. So this is going to mainly involve penetration, and it's going to have a risk for STIs, but this is also the main sexual activity that's going to have risks in pregnancy. And I think it's incredibly important to note that HRT, or hormone replacement therapy, while may make some individuals sterile, it is in no way recognized as a form of birth control. So if you or your partner or partners are on HRT, just know that there's still a chance for getting pregnant. So you should still be using condoms or some sort of birth control if you don't want to get pregnant. The way me and my partner were told to think about it is if you're trying to get pregnant while one or more of you are on HRT, pretend like you're already sterile and go through and get fertility treatments. While if you're not trying to get pregnant, pretend that there's still a chance and take all of the ways to prevent it. And so, as I mentioned, using birth control and condoms are a way to make it safer. Always use lube. Once again, it'll prevent micro tears, and then knowing each other's status is always important.
Awesome. So just a little summary of everything that we've talked about. It's really important to try to limit risks by using barriers. Like even if you are, for example, on birth control, using barrier methods can help prevent the spread of STIs. STI screenings are really great. They recommend to have them every 3 to 6 months or between partners. And also just sexual health exams in general are really important. Having contact with your provider and making sure you're communicating what exactly is going on, what sort of sexual contact you're having so that they understand what risks come with that. And just like we've been discussing, choices and behaviors that can reduce risk include limiting sexual partners, limiting or avoiding high-risk sexual behaviors, knowing your partner's status, using barrier methods, using birth control as well as backup methods, and also using PrEP. So those are just some ideas that you can choose to do to reduce risks. And we also have a link in the corner that you can go ahead and pause this and scan if you want to look at more details about safer sex for trans bodies.
Okay, so normally we would do a demonstration. However, we don't have the materials to properly do it, and it's not as effective as it is in person. So there is a link at the bottom if you want to see how to put on a condom. If you need that reference, there is the code down there that you can scan. You could also YouTube it. This one was a BuzzFeed video that was pretty good, so you could just look at those, and there are the instructions there as well to put on a condom. And one that I want to highlight is get consent. That's the basis of every step that you're doing with any of these tools or resources.
Awesome.
And then this is an internal condom. You may have heard of them also referred to as a female condom, but that's not really inclusive, especially because of the fact that you can use these up an anus too. So it's really for all genders to use. So yeah, there's another video showing you what an internal condom is, how to use it. I think the big takeaways are these are always non-latex. So if you have a latex allergy, you're free to use these. As I mentioned, you can use these up a vagina or an anus, but if you're using it for anal sex, make sure to take out the ring from the inside. And just, you can put these in hours ahead of time. So you can go out to the club and have it already in and ready to go.
That's my favorite fact.
I think it lasts what, like up to 8 hours or something?
8 hours, yeah.
So you could really be ready. Lube. So we love lube. Honestly, honestly, we talk about lube so often as sexual health peer educators, and probably one of our answers to everything is lube. But so there are a couple types of lube. So there's water-based lube, silicone-based lube, and oil-based lube. Water-based and silicone-based are the two preferred and recommended. Oil-based sometimes is irritable and just not as recommended as water-based and silicone-based. And then with silicone-based, you have to be really careful when you're using sex toys with that, especially silicone sex toys, because you don't want to use silicone-based lube with silicone-based sex toys, because it can break down the sex toys, and you don't want that happening inside your body or any of your partner's body. So it would be recommended, if you prefer silicone-based lube and you are using a sex toy, put a condom on it. But it's probably safer just to use water-based lube if you are using those sex toys. And then, yeah, so it just depends on your preference for lube. Water-based lube tends to, sometimes you have to reapply it a little bit more. It's a little bit thinner in, it's not as it's just a little bit thinner. It's not as viscous material. And then silicone-based, you don't have to reapply it as much, and it's going to be a little bit heavier. So it's just on your preference. And then, yeah.
And I just wanted to throw in also that it's not a good idea to use oil-based lube with condoms, because that will break down the condom. So if you are using a condom or a dental dam, try to use either water-based or silicone-based lube.
Yes, thank you, Hannah.
Yeah. Okay, so dams, dental dams. So what are dental dams? Do people even use them? I've heard this question a million times. So dental dams are really awesome, and they are for oral sex, so either sex on a vulva or on an anus. And basically what you do is you put some lube on the surface and pop the dental dam on there, and it sticks really well, and then you can go to work. We also have a link below there, and referring to the question, do people really use these? I think there's not too much knowledge about it out in the community, and I think the more we destigmatize STIs, especially because they can happen from from a lot of different types of sexual contact, including oral sex, like the more we just destigmatize STIs, the more we can destigmatize the use of dental dams as something that's completely normal, and also really great if you are looking to reduce risks of contracting STIs. So go ahead and click that link if you're interested. Yeah.
With dental dams, just working some workshops, I've had some queer women come up to me. They're like, "Can you give me all of your dental dams?" They're like, "Me and my partner started using this, and they're like, we love it." Fun fact with dental dams, you could also, put a little food on there if you want, a little bit of hot chocolate, a little bit of whipped cream, and it doesn't touch your skin directly. And that's a way to get kinky without having something directly on your skin. But from my personal experience hearing from other people, once they found out about it, people did really enjoy it.
Yeah, that's been my personal experience too, as a queer woman. Also, if you don't have a dental dam, or if they're too expensive, because they are slightly more expensive than condoms, you can cut a condom into a dental dam by cutting the top and the bottom and then just cutting up the length, and then you have a dental dam right there.
And these are all resources that are available at the health center typically.
Yes.
Yeah, and then just my favorite thing about dental dams that I love to do when I'm in person, I can't do it here, but I love to show it on our penis demonstrators, because it looks like a funky ghost and it shows why you can't use them. So when you're thinking of dental dams, don't use it on a penis. It looks like a ghost, not the mood for sex.
Doesn't work.
You can have spooky sex in other ways.
Yes. And then, so we're going to talk about gloves. As I mentioned with sex with hands, this is a great way to mitigate transmitting STIs down there. Just throw it on, go to work. What's a really fun fact that I learned is, if you have acrylics or sharper nails that you want to keep but don't want to scratch your partner, throw a little bit of cotton balls into the glove before you put them on, and then put them on, and it'll soften and make sure you're not scratching as much. And then just another way that gloves can be used is cutting them into capes, which for trans men or trans masculine individuals on HRT, they might experience some growth on their clitoris, making a T penis, as it says here. And essentially, you can just follow these instructions, and it's a way to make both a dental dam while also protecting that enlarged clitoris. So yeah, just pause it, follow the instructions. I don't have a glove to do it.
It's pretty straightforward and pretty easy. And there are like videos online if you want to Google how to make a cape, if you need step-by-step instructions. But yeah, so this is a video that is really, really great. It's by Planned Parenthood, so there's the code there if you want to pause it and scan it and watch it. It talks about PrEP and PEP, which reduces and really, really almost eliminates the chances of contracting HIV, which is, it's revolutionary. It's awesome. So if you don't know about it, it's available at the health center as well, but there's a video on it to learn about it.